I'm Peter Block with the Cardiosaurus Heart Minute, and today I'm with Chris Cannon. And we're talking about some of the new stories that have come up in the last couple of weeks that are of interest. One of those is a story in JACC, which concerns a comparison between the thrombin inhibitor Dabigatran versus the anti-10A agents Apixaban and Rivaroxaban. This was an indirect comparison, and it's really difficult to understand with all of those comparisons in the previous trials exactly what kind of a conclusion, I guess, is you can reach with this. So they tried to put together all of these three agents and compare them against warfarin. You wrote an editorial on this, Chris. What's your take on this?
Well, it's a very hot topic, obviously. We have three new drugs. Each trial showed benefits over warfarin, and so we then are asking, well, which one of these should we use? And so it's very tempting to compare to that one common denominator, the warfarin. I think what's clear is that each of them has advantages, but when comparing one agent to the other, the problem is that the trials do have differences between them. So some have patients with very high CHADS risk score, others have the full range. There's also differences in how the warfarin was managed, with differences in the time of therapeutic or time in therapeutic range of the patients in the warfarin group. So you can't attribute all of the difference seen relative to warfarin to the new drug. Some of it is the control group in the population.
Right. It looks to me like probably we're still going to have to wait for direct head-to-head comparisons between these agents. I doubt, candidly, that will ever be done. But until then, we'll have to do the best we can, probably going back to the original studies. Wouldn't you agree?
Exactly. I think, these are all large trials, and so each of them individually provides us with very good evidence for what the efficacy and safety is in preventing strokes. It's often less bleeding, certainly fewer hemorrhagic strokes. So I think some real advantages of the new agents, but relying on the individual trials is probably the right answer.
So good agents, but the jury's still out, and we'll just have to wait and see. Thanks.